everyone, this is Dr. Schroeder with this week's video introduction to week number 6. A little bit of a belated introduction this week. Here on a course in the principles of healthcare education. And again, a very good discussion. Lots of good, robust discussion, lots of good points made in class this week. And of course, the discussion question in week number 5 focused on this concept of special populations, and primarily special populations of patients, and how do we address their particular needs. And a lot of really good discussion came from that particular question. And the case study within the question, of course, was a schizophrenic patient, and some of the challenges that would be faced in providing education not only to this particular patient, but also you have to look in terms of the patient's family, particularly with schizophrenia. You could actually fit any number of cases in this particular question. We could have used autism. We could have used any number of post-traumatic stress, any number of mental health diagnoses, even the homeless population or illiteracy. These are all special populations that have needs that need to be addressed. Everybody by now has received feedback on your paper, so congratulations. Everybody made it through that particular assignment. And we have one more presentation coming up that's going to be due this week, the CUSIN presentation. One question that came up, I'll just address real quick, is that I would like you to include speaker notes. Speaker notes are when you're in the slide creation design box. You'll see that there's a little place where you can enter notes at the bottom of that underneath each slide. You don't have to write a paper. You don't have to write a separate bibliography. You don't have to do any other Word document. Just if you include the speaker's notes, which are essentially a script of what you would be saying if you were giving this presentation in front of a live audience. That's the best way to do that. It's easier than trying to record something or writing a paper that usually more times than not is just kind of sort of redundant of what you already have on your slides. Remember, your slides should just be presenting information and should be reserved for primarily graphics and for information that you're going to be presenting in a real presentation through your spoken voice and through the interaction that you have with an audience. So that's why those speaker's notes are important. And a presentation isn't just a paper that's converted into slide format. It's actually presenting information using graphical information and something that's visually appealing. Learning how to do an effective presentation is very important for any educator. All of us use, I think PowerPoint is the gold standard presentation software. It's not the only presentation software, but it's the one that is the most widely used and disseminated. It is the one that I think most people are most familiar with. And knowing how to use PowerPoint, how to create a effective presentation is it's all important. It's as important to an educator as knowing how to write well as for a writer. So please review the rubric and review the criteria for that particular assignment, and those will be due by Sunday of this week. And that brings us on to this week's topic. This week's topic, we're going to, for the discussion question, we're going to be reviewing a question that came up earlier in the class. It's the question of continuing education, and we're going to assume that you're working in a state that doesn't have a continuing education requirement. However, even in those states where continuing education is not required, it is usually then contingent on the hospitals then to provide that. So you're going to discuss some of the aspects that go on with that and discuss some of the factors that you need to take into account while you are developing those continuing education units. So that pretty much wraps up for this week. Again, the presentation is the one big last deliverable for the class. And then, of course, the discussion questions this week and next week. I look forward to participating along in the class with you and to answering questions as we move along. Please, as you have any questions about the presentation, go ahead and let me know. And everybody have a great week, and I'll look forward to seeing you in the discussion forums.